Hey guys, Dr. John Mark Chesney here. I'm a licensed physical therapist and owner of Simply Physio. Today we're talking about the top 5 stretches or mobility exercises that you can do for patella-femoral knee pain or runner's knee. So this is pain typically experienced here in the front part of the knee that's related to the kneecap. We're going to be looking at structures that we find are typically restricted that can aid in your recovery process. So the first thing is understanding part of the rotation around the knee and how it can get locked up. So the first thing is, you want to do a test to see if this is something you're restricted in, and it's your ability to internally rotate your tibia or your shin bone. So internal rotation is moving in, and what we like to see is 15 to 20 degrees of being able to rotate in. Your knees want to stay still, and you're just rotating, you're pivoting right directly underneath, and your feet are staying flat. So again, this is a common thing that we'll find is a lack of rotation and with this type of injury. And so when that's the case, then we want to work on improving that. So I'm going to use a few tools here that will help with some of these techniques, and you can find descriptions or links where you can purchase these as well in the comments or in the description of this video. A wrap like this is helpful for the first exercise. It's not critical that you have it, but if you do have something, they're pretty inexpensive to get, so it's a nice thing to have. But what I find is what I'll do is I'll wrap my knee to show you how I'm doing it. And so I want to wrap in. So if you see, I'm starting from the outside and I'm coming in. So I'm helping to influence that internal rotation. What the wrap does, it makes the technique more comfortable. It gives me a better grip instead of just kind of clinging onto the skin. It helps me just to get better pressure there where I want it. So I have it wrapped up right there. This here, and you can see kind of directly on. So what I'm going to be doing is just holding on kind of right there at the shin, and I want to be rotating, turning in the shin bone, and then from there what I'm doing is I'm just lunging kind of on the step while I'm holding that position. So I'm working on increasing that tibial internal rotation as I'm doing a lunge and a knee flexion exercise. So working it like that, usually 10, 12, 15 times. And then the second one is associated with this rotation, but now we're going to be working it from more of the ankle joint. So what I'm doing here is I want to improve the lateral movement of the ankle joint, which gets locked up oftentimes with this type of knee pain. So what I'm looking to do is I want to use my hand to really stabilize my foot, trying to keep it flat, and then I'm pressing out with the knee. So this, you may feel a little bit of pressure here at the ankle. You're not going to feel a stretch like you would like doing a muscle stretch, but you're just working on improving this excursion, this lateral kind of excursion of the ankle and the knee, while I'm stabilizing again the foot so that it's more from the ankle right here, and I'm pressing out like that. There's a few different hand positions. This is kind of my favorite. You can hold with both hands and then just kind of drive with kind of the hip, kind of pulling out like that too, is another option right there. So those are the first two. I'm going to take this wrap off, show you the next one. Here is we're looking at freeing up actually the kneecap. So ideal if you had a cup. I'll show you an alternative without the cup, but I'm gonna be here on the floor just with my knee flat. So what I'm looking at is the kneecap can just get restricted, and so I can just work on moving the kneecap. Usually it needs to come more in. So I'm just giving some pressure, doing some kneecap mobilizations. Now, where it really gets fun is if you have a large cup that you can fit. So this is again a cupping piece, but if you can fit this around the kneecap, and I'm just giving it some tension with the squeeze, and then I have good pressure. So now I'm getting a lifting of the kneecap. Do that again. There we go. So I'm getting some good distraction of the kneecap. So I'm getting a lift, and now I can even move it back and forth, you know, really thinking about kind of pulling in. So I'm getting the added benefit of that distraction with some kneecap mobilization. I can move it, you know, a few different directions. I can do some circles right there, but that should feel good. So that kneecap is that distraction with some of that knee mobilizations. Again, typically focusing on that inward position there. All right, so that's cupping there for the knee. All right, the next one, again, you can, this is a fasciitis fighter, something we have in the clinic. You can create something just with a towel roll, but I'll show you how we use it. Now this is oftentimes, again, what we find with people is limited toe extension. So their ability to bring the toe up is going to influence how the knee mechanics and just the mechanics of how the lower leg works. So if you're restricted with your ability to extend the toe, we need to work on stretching that. So you can see I have actually pretty good toe extension, so I don't need to work on this for myself, but a lot of people are restricted in their big toe extension. And we like to see about at least 45 degrees, if not more, of toe extension. So if you had something like this, or just a towel roll you can do as well. I can put my foot up there on the roll so my toe's up. And then what I can do is just kind of lean forward. So I'm getting maybe a stretch with the calf, but in that position, I'm getting a good stretch to my toe and my foot. Just leaning forward like that. So I can increase that stretch by coming up there, kind of on my toes. And this is kind of the next level where you'll get even a stronger stretch there through the toe. Maybe even you'll feel that through the arch of the foot as well, to work on that piece. So the fifth and last mobility or exercise stretch is the IT band. So I'll show you how I like to do the IT band. The IT band is starts off with as a muscle and then turns into more of connective tissue that travels from the hip all the way down and attaches to the outside of the knee. Some of the fibers of the IT band actually can attach right there to the kneecap. So if that's tight, it can pull the kneecap over again to the side. So what I like doing is with my IT band stretch is doing a little bit more dynamic instead of just holding it. So it's more of a walking IT band stretch. So we want to get two components. If we get kind of this cross leg, so I'll show you kind of face on. So we're throwing the hip out to the side. So we're getting this cross. I'm stretching this right side right here. And then what I want to do is add in an overarm opposite direction. So I'm kind of creating this C. So I can hold that just even for 4 or 5 seconds. And then I like to just step and just do it the opposite way. So we're getting both like that. So I'm doing it through kind of a length. So, you know, holding that, getting just a good quick kind of stretch, and then coming back the other way, throwing the hip to the side, arm over, and then just going back and forth. It's a good warm up stretch there for the IT band. So guys, that's 5 mobility stretches for you to try and do that can help with patella-femoral knee pain. Thanks for watching the video. If you like the content, be sure to subscribe to the channel. We appreciate you guys. Thanks.